Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and I want to talk a little bit today about occlusal adjustment, or commonly called bite adjustment. So normally a good occlusion should be something like this, where the teeth come together, all the teeth are touching evenly, and it's comfortable for the patient. But sometimes the bite could be off. For instance, it could be something like this, where the right side is hitting hard and the left side's not hitting at all. Or it could be that some of the teeth in the front are hitting harder and the back teeth aren't hitting. So all kinds of things are possible. But we want to make sure that the pressures are distributed evenly, the patient's comfortable, some teeth aren't hitting too hard or being loosened by the bite. So we want to have a good, solid bite, so it sounds kind of like that. Occlusal adjustment is usually done, at least in my office, if a patient is having pain from their joint, the temporomandibular joint. Very often that can be caused by a bite that's not correct, so that they may be clenching or grinding their teeth because their bite isn't quite correct. So by polishing or grinding away a little bit of the tooth surface, we can change the bite and try to get the alignment in better shape so that the patient doesn't feel uncomfortable and feel that need to clench or grind the teeth together. Also, if some teeth are very loose, that means they may not be able to handle normal biting pressure. So we may take the pressure off of those teeth by filing those teeth down so they're not hitting so hard because they're already weak, possibly because of periodontal disease and bone loss, and we want to reduce the pressure on those teeth so they're not under so much stress. Also, sometimes we can do minor bite adjustment for cosmetic reasons. Sometimes one tooth may stick down or stick out a little bit further, particularly if it sticks down or sticks up. With minor adjustment, we can correct that, or at least improve the look and the cosmetics of it, so it's not as protruded or it's not as obvious as it has been. And actually, bite adjustment can even be done by adding to a tooth surface, by putting a crown on a tooth, or even a filling on a tooth can change the bite, which is actually a form of occlusal adjustment. Usually occlusal adjustment is not painful, but it's not reversible either, because if you're removing part of the tooth, we can't grow that tooth back. Yes, we can put a filling in or a crown, but that gets a little bit complicated. So occlusal adjustment is very, very important. It's an integral part of dental treatment and periodontal treatment, but it has to be done carefully because it is not reversible, and you want to make sure that you're doing something that's going to be of benefit to the tooth or to the patient. So how long does an occlusal adjustment take? An occlusal adjustment can take a minute if it's very, very minor, by just, polishing a tooth surface, one tooth surface slightly, or it can take many appointments, depending on how severe the occlusal discrepancy or the bite is as far as being correct. So it can vary, and as far as cost is concerned, one wonders how much it can be like no charge at all, especially if it's very, very minor. Your dentist or periodontist may simply do it as part of his normal treatment without any charge. But if it's going to be involved, then the charge could be anything, a few $100s, possibly even a few $1,000s if it's quite complicated or involved. But it's a very important procedure because if one's bite is not correct, it can lead to clenching, grinding, loosening of the teeth. It can have many negative effects. So it's a very important part of what we do to try to get the patient ideal health and maximize their comfort. If you feel your bite's not right, we do bite adjustment here. It's part of what we normally do, and so you can contact us and we can check it and let you know what our thoughts are. Your bite may be perfect or it may not be. At any rate, make sure your mouth is healthy, because if your mouth isn't healthy, you can't be as healthy as possible. So take good care of yourself. Subscribe to our YouTube channel. We'd love to hear from you. Questions, comments. Anyway, take care of yourself. Healthy mouth, healthier body. Have a great, great day.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.